Tustin, California. And hello, Dr. J. How are you?
Hey, good. How are you, Nick?
Terrific. It's so we're so happy you could make it down here. You've got a fascinating situation over there.
And the topic, just so we tease, the topic you're going to talk about is erectile dysfunction, which every man immediately giggles, and then he goes, well, wait a minute, it's not quite so funny here. We sort of self-consciously say, oh, that could be me, or maybe that is me.
That's true. But that's just one of the many aspects that Dr. J treats at your facility. I was completely blown away by the sophistication, your layout, the phenomenal staff that you have. And I think there's a lot of people out there, guys and girls, that need to know who you are and what you've got. Can you, what you can offer them? Can you tell us a little bit about the path you took to get to where you are today?
Well, I started my practice about 30 years ago. Just to make it short and sweet, I was born in Kenya, Africa, moved to India, did my medical school there, and then went to Chicago at Cook County Hospital, then Christ Hospital, and then moved to Orange County, California. So I practice in Tustin, California. So I have been fortunate to practice with the creation of multi-specialty medical group, holistic office, and the cosmetic laser center. I've been doing studying and research practically all my life. So I became an internist and then a cosmetic surgeon. So I do things inside out, 360 with the holistic approach. I'm a vegan, and I add a lot of plant-based nutrition into people's food style, I call it.
This is a really important aspect of, especially for those that are aging and want to pay attention to how they're aging and how well they're aging. What is the age spectrum of your patients?
Basically, from teenagers to young adults, mature adults, to older age group, to the very old. So, well, we call it seniors, So basically, it's a whole spectrum. And what I have observed from seeing all the erectile dysfunction in males pertaining to that, up to 30 to 50% of the adult population over age 40 and 50 have some erectile dysfunction issue.
That's interesting. For a variety of reasons, for different related to different physical attributes or ailments.
It could be psychogenic.
Okay.
It could be because of the medications. It could be diabetes. It could be vascular disease. So there are quite a few reasons. Sometimes you find they have a low testosterone. So basically it's a multi-pronged approach. So we have quite a few different strategies of treatment.
One of those treatments I know which is very exciting, is called the shockwave treatment. It's created a real buzz in the men's health community. I know all my buddies are talking about it. Can you tell us a little bit more about how that works and how it can also be used in conjunction with other the holistic approach?
Nick, I would love to tell you, but I have to say this, that to do the shockwave treatment on the penile organ and in the vicinity, we need to address the hormonal situations like testosterone level. Some people want to know their growth hormone levels, address their sugar, blood pressure, medications changes. So given all these things and given all the treatments, there are people who would need more help, significant population needing Viagra, Cialis, medications like that. So people want to get treated without medications. So the shock wave is an acoustic wave. It's a sound wave. It helps the vasculogenic erectile dysfunction, meaning by the circulation issues to the penis is compromised. So this, in layman's term, this shock wave or acoustic wave or a sound wave, it just breaks down the plaques and stimulates the growth of the tissue. So this way, after giving 2 to 3 treatments a week, for a total of 6 treatments with a shock wave to the penile area, people have 80% result of having a fairly good erection.
That is, I got to tell you, that number is stunning. I would almost want to say that sounds a little too good to be true, but I recently read an Israeli study with several Israeli MDs, a long study with a very large subject population that not only came to that number as well, but in fact stated that in some of the men, a significant portion of them, 2 years later, they were still having spontaneous erections without the need for pills or injections. And that being the case, that should make you one of the most popular guys in Southern California these days.
Well, besides Israel, certainly there is a European study or studies, fascinating results. So been there for 15 years and now it's catching up in the US. So people are recognizing these treatments and they are available in US, and we have it in Orange County.
Yes, you've hooked up with, I believe you're delivering this treatment in association with Malelogics, which is a men's health juggernaut that's really bringing a lot of advanced changes to what would normally be a fragmented men's health landscape. Tell me something. Are men being a little bit more open with this issue today than they were just? It's not your father's Oldsmobile, so to speak. I mean, than we were in the past.
I would say many are and some are not. So what we do is we always ask questions, and that's the best way of doing things. We need to also make sure their PSA, prostate cancer test, is normal, and they don't have a prostate cancer and stuff like that. So yes, this is a part of the protocol of asking questions. Interestingly, they seem to work with my male staff and female staff, my assistants. So I thought in the beginning they would be a little shy. So I have Ardi, who is my physician assistant, and I thought I'll give him the responsibility to do that. But hey, my female staff, they don't want to be left behind. So they are interested in treating. So we do Doppler ultrasound for the circulation of the penis, to shockwave treatments, and patients seem to just like any stuff, and they open up.
It's clear that they must be seeing results, or you wouldn't experience that type of feedback. Can you describe the basic treatment protocol with the shockwave and other things that might go along with it as a place to get started for the average guy?
Yeah. So when someone comes in, we explain. Of course, I've never seen any or read any side effects from that.
No
Because
side effects.
that I have seen.
That's
Of course, we
that's
have to tell people there could be some bruising, some pain, discomfort during, after, but like anything else.
it's non-invasive as well.
Correct. So
So what they might experience then is kind of a vibration effect, a feeling of vibration. Is that correct?
So basically, yeah, the little thumping
Okay.
on the penile shaft that they feel, and also behind the scrotum in that area. So we need to treat the whole complex, and 3 times a week for 2 weeks. So that's 6 sessions, and we can always do maintenance sessions as needed. So that's the protocol. But people can come once a week, every 2 weeks, once a month, and
For a tune-up,
to
so to speak.
to finish the treatment.
I see.
So you don't have to do 6 treatments in 2 weeks' time.
Ah,
So
okay.
all those variations of treatments, they work.
You know what? There's an old joke in here that's coming to mind that you can play some lively music on an older fiddle as long as it's in tune. So I would imagine that it's in everybody's best interest to maintain the highest level of to get to a level where they're achieving higher function and then keep it there.
Well, there's another observation I have.
Mm-hmm.
When my female patients find out, they want to send their counterparts.
Their
You know?
partners.
Yes, they want to send the partners for the treatment.
And
And that works, So point is, it's not just talking to all the males. Is when we talk to women, they go, yes, do you do that?
Amazing. Yeah, it's you know what it's going to. It's like I said, it's created quite a buzz. I'm sure that your schedule is going off the charts, and I just wonder though. I just wonder what are there any downsides at all to the treatment? I mean, anything at all?
Well,
either physical or
from the ones we did, we have not seen any downside. In fact, I would like to, ask other colleagues, but the experience in US is very limited.
Mm-hmm.
But the common sense dictates. If you just have a sound wave, acoustic waves going to the area, to the tissue, what could be the side effect? Pain, swelling, bruising. I've not noticed that. And we ask patients when they get treatments done about their comfort level, and there's a numbing cream that is smeared on an hour before they get the treatment done. So it's quite comfortable.
So for anybody who's listening to this podcast that grew up in the 60s or 70s, went to any festival concert where you stood in front of a rock band with a set of Marshall amps, you're it's probably not going to be any worse than that, I would imagine.
I think they're all happy, and
Okay.
and as I said, that let's say 80% of people would have a significant result, fairly good result or excellent result, but we can also increase the result with doing PRP. Can take the blood, spin the growth factor.
Now, you're talking about platelet-rich platelets.
Yeah,
correct?
PRP.
Tell us a little bit more about that.
So-
Go on, please.
So what we do is we would draw the blood and spin it and get the growth factor out of it and inject in the penile areas. Approximately 6 little shots, hair-like needle. The area is numb. There's ice on it, so you hardly feel much of any pain, and it takes a month to see the effect.
What is the ultimate effect of PRP therapy?
Basically, it's a rejuvenation of the area and stimulating the growth of the tissue.
This is just one. Would this be related to stem cell in some way, or a different discipline?
A stem cell is a different discipline where that's something that we can do if need to, So we do for other reasons, for the joints, for the facial rejuvenation. So I'm sure there will be more studies, but that's in a research phase. So we can include that along with injecting fillers. So after shockwave PRP, we can do fillers like we do on the face. Botox fillers, all kind of things for the face. Similarly, we do this part.
And you can, if somebody has Peyronie's syndrome, you could potentially
break down the tissues and help Peyronie's syndrome with a shockwave.
Oh, man, you can do it all. This is big news. This is big news.
Yeah.
This is very big news for Orange County. Is there anything else we can conclude with?
Well, the one thing that anyone would like to know is where could I find Dr. J? If they look for, if they call 714-832-8226.
Let's do it again. 714-832-8226.
They can reach us. The other thing is, I give my cell phone to each and every patient.
Wow.
I probably have 5-10 of thousands of families, and I hardly get phone calls after hours. So it's not like you cannot give. Like typically you can't have a doctor's cell phone. So everybody is my cell phone, which is 714-235-3959. It's 714-235-3959.
I'm going to dial you up myself here in a minute.
It's on my business card.
That is very unusual.
And
that available. Make yourself that available to your patients.
Yeah, and I direct them to drjusa.com, which is drjayusa.com for further information to contact me. So that makes it easier.
I think you've made it very easy, and thank you for being here. I think we've blown a lot of minds today, and that's a wrap for us.
I just want to commend you all for coming in and talking about this topic here. It's certainly fascinating. Somebody tweeted in while we were listening, where and when did this therapy get developed? Where is this from, and how long have they been doing this?
As Nick was saying earlier, it was developed in Israel, and then there's a European experience of 15 years, and then came to U.S.
And how did you discover it? It can't be something that's very commonly... You say it's very uncommon here in the States, so how did you stumble across it?
In Florida, it started, and then East Coast.
Didn't Mailogics bring it to your attention?
Correct.
Mm-hmm.
Came across, and they brought it, and now you've brought it here to Orange County. All right, thank you. So give us your center again. What's the name of it, and how do they reach you?
It's at Tustin Place Medical Group in city of Tustin.
All right, and the phone number?
714-832-8226.
And what's the name? If somebody wanted to Google this and do some research before they came in, what would they look? What's the technical term? You call it shockwave. What's the technical term for this? How would somebody find this and read up about this technique?
LIEWST, right?
Well, it's a shock wave for erectile dysfunction.
Oh, okay. So that's what they call. I thought that was just your brand name that you call it here.
They can actually. I happen to have some crib notes written on my thumb here. They can actually
all right,
actually Google low intensity extracorporeal shock wave therapy.
Okay.
And they'll get all they need to know about this remarkable technology.
But I think it's hard to remember everything, so I just tell them just shock wave for erectile dysfunction, penile issues, it will come up.
Well, it's a shock that we're talking about this here on the radio today, but I appreciate you coming in, and I know it's really a serious subject for a lot of people, including many I know. So thanks for coming by and being here on the OC Spotlight.
Thank you, Nick.